find it okay?
I think we should be live, right? Okay. All right. Well, after a 3-week break, we are back and hoping that we will be back to our weekly routine. This is United Medical ACO. My name is Kemal Erkan. I'm the chairman for the ACO as well as American Surgery Center. We are here today to give you the latest updates from COVID-19 and also what's happening with the vaccination, what are some of the concerns. But let's start with the good news from the vaccine world. So I'm going to share my screen right now. And I have Tanner from our business development with me, and then later on, Richa Shah from our revenue cycle management part is going to be part of us. All right, so, and I'll ask my team if there are any problems, if they can let us know, but we should be okay otherwise. All right, so the good news is right now we have COVID-19 vaccine is available for anyone ages over 16 and over. So this is for Delaware. So those people at that age range, they can actually get their vaccination. The best place to get your vaccine is your primary care. Well, in this case, it may be your pediatricians, but there are public places available. So please get vaccinated because this is important for all of us. What you do need to do for registering 16 and plus is you can request an appointment with pharmacies, and also vaccination events, and as well as the medical providers. Now, Pfizer is the only option that's available for those between 16 to 18. So you need, that's the only vaccine that's approved. And then we also want to mention, before we start the session, we do want to mention this for our patients. We have with specific insurances, and this is the one that I'm sharing right now is from Highmark, and this is available for Highmark commercial and health options. There are 24/7 nurse triage lines that's available if you are a Highmark commercial or Highmark health option patient. And also if you are from another Medicaid managed care, which is MeriHealth Caritas. If you have MeriHealth Caritas, you can also utilize the 24/7 nurse triage line. This is especially, it's important for those where you shouldn't be going to the hospital, but getting triage is a really good way to avoid some of the hospital visitations. Now, going back to what we are going to do today, we have the COVID-19 numbers, as I said, and some of the research data, but we are going to also discuss the United Medical's RCM overview. We have some changes coming up for some of our clients, so we are going to actually have Richa Shah joining us, Richa Sabesan joining us to give us the perspective of United Medical for those clients. So, but let's first start with, we utilize Worldometer for the nationwide and statewide information. So this is pretty user-friendly for us. What I normally do is look at the numbers from 2 days ago, and then what we need to be concerned today is the numbers that we have at 75,000, which is extremely high for what we have so far. And then we also have, yesterday we had actually one of the highest day with 80,000. So number of deaths, you can see that's over 1,000 yesterday, and the day before was 872. And so far today, this is because it's a real-time data, so it's not going to be there yet. But yesterday, for example, we knew that this number was going to be high because 6 p.m. it was already at 75,000. So if you look at our home state here in Delaware, what you'll see is the hospitalization, the total hospitalization, current hospitalization, and total numbers of the positives. So we are at 145 total hospitalization related to COVID, and it's about 24 new admissions as of April 7th. That data is 2 days old. They normally state updates these around like 2 p.m. Percent of person testing in Delaware as of the April 7th is about 23%. Percent of tests that are positive, so that number is at 5.4%. So now, if you look at the total new positive cases, as you can see, this number is at 314. It is increasing, and we really need to be mindful of what we do and how we live day to day, what choices we make, because it is these numbers are still high. So I'm not going to ruin your Friday by giving you too many bad news. So let's actually go back to our PowerPoints. So now, Tanner, I'm going to have you go through some of the vaccine updates. So as many of you already know, Tanner actually works in our business development department. And because we have our provider meetings on a weekly basis, twice a week, every Monday and every Thursday, we meet with all of our providers nationwide, 6 p.m., and we give all the updates. That used to be a daily event for us in the beginning of pandemic. Right now, we are twice a week, and many of the other members, Tanner also is part of that, but he's more interested in the vaccine and the rollout of the vaccine. So I'm going to ask him to go through the vaccine updates for us.
Thank you very much, Kemal. I appreciate that in the introduction. So what we wanted to first start off with was, again, carrying on with the good news with the vaccine. We wanted to show you, everyone, how we're actually increasing and continuing to increase our average daily administered doses of the vaccine. So if you remember from the past few sessions over the past couple of months, we've really been talking about getting to our target for the daily amount of doses that are administered, and we wanted to be around at least that 2 million a day mark on a rolling average. So what that would do would kind of speed along the process that we could get to herd immunity as a community, as a society. And what that is eventually going to do is reduce the risk of transmission of the disease amongst the population to just continue to lower that risk of actually having transmission of the disease while going out in public. So at 2 million, we were looking to get to about 75% of the population covered by the end of summer. But as you see here, we've already started to exceed that goal amount. So just this past weekend, I believe there was a record amount of vaccines that were administered in a day, and that was well over 4 million there. So on the average, looking back, this is a 7-day rolling average, we have broke that 3 million a day mark, which is great news. So looking to continue that trend upward, as long as, of course, barring any logistical issues with the rollout. I know late in the winter, rather, we were seeing some issues with winter weather getting in the way of the rollout. So hopefully we're past that as we are looking forward to the spring.
So Tanner, I think the really good part of this one is getting to over 3 million a day. That was almost impossible. And I think we are doing that right now. So I think we're going to get to that target even earlier, right?
Mm-hmm. That's correct. Yeah, and we'll take a look at some of those numbers as well, because you're right in saying that that mark was very difficult to get to, and we were even hoping to get to the 2.5 million mark a day for a little while, but we're seeing now getting into the 3 million a day is great news. So kind of just taking a look at how those vaccines that we have approved are kind of being allocated here with the distribution. You can see over time, these dotted lines are going to be our projections for the amount of vaccine that is supplied or delivered. Those are our delivery targets, are those vertical lines underneath each different vaccine manufacturer here. So what this is showing us is where exactly are we at with the amount of vaccine that is available. So that black line we see here in between March and May, right around that April mark where we're at right now, is the amount of vaccine we have available for distribution here in the United States. So with the deals that the government has made with both Pfizer and Moderna, that was going to get us to that 300 million mark eventually. And they said that they would be able to supply that amount, that promised amount of vaccine by the summertime. So you can see that by that those lines there on the right, that's our projection or our delivery targets rather. With the addition of the 100 million vaccines from Johnson & Johnson, we can see that that mark or that delivery target of 400 million is going to be achievable. And we hoping that we can get there by the summer still at this point, as long as, again, barring any issues with logistical production of the vaccine and distribution of the vaccine, that's all going to be great news. So we can get to about that 400 million people covered mark by the middle of the summer. Again, remember that is just having enough vaccine to cover that many people. We still have to get through the actual administration of the vaccine. And that's going to continue with education of the public and making sure people have access to vaccine distribution centers. So here again, we're kind of looking at where we're at with that target of the herd immunity. So with everything being said, let's say beginning of April 2021, which is where we're at right now, we're getting about 3 million doses on average being, or being administered a day. So at that pace, that record or that number that we're looking for at 75% will receive at least the first dose. We can get there by July at this point. Now, previously, that was something we were hoping to get to by August, September, October, that time frame. So this is really good news with the distribution, as long as with things being said, as we previously looked at, with the current rate that we're on and with the continuation of the distribution of those three vaccine players, we kind of have all the pieces of the puzzle now to get to a herd immunity at some point this summer, as long as everything goes well and goes smooth. So here's kind of where we're at currently. I like this graph because it really shows, you can kind of easily tell visually where we're at across the nation with the amount of population that are being covered. And I highlighted Delaware, of course, as that's going to be relevant to us, and we're interested in how we're doing here with the actual distribution of the vaccine. So you can see in Delaware, we're at a little over 500,000 doses that have been given, which is covering roughly about 28% of the population right now. So you can kind of see here, the darker the state is, the more of the population that has been vaccinated. Delaware kind of in that light green, kind of right on average, we'll see here shortly, matching the national average of the population that's being covered. While we do have some other states that are lagging a little bit behind, there are some states that seem to be doing vaccinating their populations a little more effectively or efficiently for one reason or another. We can get into a handful of different reasons why that might be, but I at least wanted to show where we're at in comparison to some other states around us. So with that being said, why is this all important? I know this is something that's kind of routine at this point for us to share and to discuss. And as Kemal mentioned, where this is all information that we're sharing on a regular basis with our providers as well. And it might sound redundant or repetitive on the day-to-day and being told this information on a week-to-week basis, but it's really important to make sure that we're giving out the information and that we're presenting all the information that we have to our patient population, to our providers, so we can continue on that education, as I mentioned, which is really a vital piece in the vaccination process. As there have been numerous studies that show, as well as the information is coming from a provider or a primary care setting, that's where people are most comfortable with hearing their information, especially when it comes to medical decisions And in a time like this, that's going to be the best place, or that's going to be a very effective place to get vaccine education into the hands of our patient population. So we want to continue to make sure everyone's aware and understands exactly what's going on with the process, and a little bit about the vaccines as well. So this is also something we have continued to share, and it's just kind of breaking down the different, not only side effects, but what is the semantic difference between each vaccine. So although they are these mRNA vaccines, there are a little bit of differences in efficacy that we can kind of see here through the trial rates. And now we are starting to see with real-time live data that a lot of this trial data is being reflected as correct and accurate. And you can just kind of see here that most of the vaccines that we do have the three. I would like to mention that the AstraZeneca, although we have some information, it's not approved here in the United States. It is dealing with some issues abroad. So I want to make note that that is not something that is actually approved for emergency use here in the United States. Rather, the Pfizer, Moderna, and Johnson & Johnson vaccines are what we are using here on a national level here in the United States. And really the only difference is that we know at this point that the Johnson & Johnson vaccine is that one-shot 85% effective vaccine, as opposed to the Pfizer and Moderna two-shot vaccines with slightly higher efficacy rates that we saw from trials and are again seeing now. So with the ongoing continuation of the vaccine, something that we know the goal of the vaccine is to bend the curve into, as I mentioned, get to herd immunity, a point where enough of the population is covered where we're going to be able to really reduce the transmission rate of the vaccine. So now that we're a handful of months into the administration, we can kind of start to get a good gauge on, are we actually bending the curve with the vaccine? So here are two different graphs of the United States on the left and Delaware on the right. So the top graph is showing the percent of people or population that have been vaccinated. So as I kind of mentioned earlier, with that mark, it's 28%. Delaware's kind of reflecting the national average right now, right above 25%, 26%. And then below that, you can see the new positive case rates for both the United States average and Delaware on the right. So as the amount of vaccines have increased and the amount of population that has been vaccinated has increased, we are seeing a dip in the amount of new cases per million in both cases, which is really good news. And it does show that there is evidence we're starting to bend the curve. But with that being said, we want to be careful still. We want to make sure that this is data that we're continuing to monitor, and that we, as we continue to work on getting vaccines administered to the population, we don't want to take that as just a surefire, safe bet that everything's just back to normal. We want to make sure we're keeping an eye on our case numbers. As you can kind of see here, there are slight upticks as of late, even though the vaccine is still increasing. And as we've discussed, that the amount is being administered has continued to grow, we still are seeing slight upticks in case numbers. So it's definitely something to be mindful of and keep an eye on. So as I'm kind of talking about this and getting into what could be causing things like that, we still want to make sure, again, we're keeping an eye on these numbers, right? So why is that the case? Why are we keeping an eye on these numbers? Well, there could be a handful of different reasons, right? Kemal, and this is something that we started to discuss on why should we still be worried with the case numbers with the increasing vaccine. I think a lot of people might just take the vaccine as, okay, everything's good and I'm done, I'm safe.
So
that could not necessarily be the case for a number of reasons. Mm-hmm.
If the vaccine is already there, and then if people are getting vaccinated, and earlier the numbers that I showed with 80,000, 75,000 daily new confirmed cases, right? Why it's happening, and also the other thing is that what we are projecting is another wave that's coming, and if these things supposed to be controlling everything, that's getting everything under control, why is it still happening at this level? Well, I don't know if anyone knows the answer. So I'll start with that, because so far so many changes has happened while we were going through this process. What we were told, what was happening, what we were told, they were all Well, there were changes. So it's just one day, this is right. The next day, well, forget that. Now it's acting, because what we need to remember is there is the mutation of it and the variants that's happening already, that this virus is an organism and it gets smarter and it knows how to actually change as we are actually fighting with that. It's actually getting into a different form. So then getting that under control is difficult. So we actually kind of, with the different variants. So I'm going to actually just share that with our audience. So like what happens in Delaware. So each variant actually is listed here. So there are 4 different ones already here, and then there are 2 others here. There are a total of 6. Now, these are, if no one is getting vaccinated, the problem is if no one is getting vaccinated, for us to actually go through the infection, once we get infected, it's going to be a lot more difficult anyway, because we know that vaccine, I mean, it's just like the flu vaccine. So you may be getting the flu vaccine, but you still have the flu, because this year the flu is smarter than last year. So then whatever we have is based on what already we know. It's going to take care of what we know for up to this time. Anything that happens, any changes that happens after the vaccine is in place, it's not going to be stopping it, but it's going to actually take them under control. Now, the other thing that, Tanner, we want to also remember is there is the individual, the immunity of the individual, and there's the immunity of the population. So vaccine is going to work if we get to that number of 75–80%. So we will see the less cases, less daily cases, and also it's going to decrease the mortality as well, because right now we still have a lot of people losing their lives from this. But I think when we have enough immunity in population, that's going to actually make a big change. But that's going to take time to see that. And I still, like, for example, like one of the new discussions that we have, I'm going to bring that up. I mean, I don't have too many people answered yet, but just to kind of give you an idea, this is our poll that we are running on Twitter. Let me actually just share this very quickly. When we asked the question of if the vaccine should be mandatory for employees, I could be more specific here, like if it's for the healthcare employees versus not. There are a couple of hospital systems, they already went to mandatory vaccination. But as you can see, this is 64% is saying that no, it should not be mandatory, and then 36% is saying yes. Now, this is important, right? So I mean, honestly, I do believe in everyone's. I respect everyone's decision, and when it comes to mandatory, I probably would not mandate this. However, I don't know if we have a choice not to get this. In order to see where we are going to be, it's going to be extremely important for us to not only just get vaccinated, but also follow the vaccine COVID-19 protocol in place, because I still see people just, doing whatever they were doing before pandemic. So we know that a symptomatic person can infect so many other people. They may not feel anything, but then all of a sudden, people around them may get sick. And we have seen that already. We saw the holidays. Every time there was a holiday, like 2 weeks after that, there was a big wave. So now the spring break is probably the reason. We are not jealous for people being on spring break, but it is probably the cause of some of these issues. So we can't just rely on vaccine and relax just yet. But I think it's coming up. Now, what I also want to make sure we do, today we have actually 2 sessions. what I will also want to tell our audience is if patients, like this is from our actual data, from our United Medical ACO database. So people who were positive over age 50, 62% of those people were either obese or morbidly obese. So this disease, this infection is more problematic if you have comorbidities. Comorbidity meaning that if there are other illnesses, underlying issues, like obesity would be one chronic problem, but the hypertension is 65%, 66% of the people have hypertension. So then when you look at the diabetes, 34% of the people have diabetes, and then 19% have heart-related issues. Sleep apnea was about 16%, and vascular disease is about 7%. Now, going back to diabetes being at 34, and chances of these illnesses, one person having these illnesses together is very high. So if you have obesity, you do have, most likely, you have hypertension. Most likely you may have diabetes. If you have all these three chronic illnesses together, then when you get to COVID, it is a huge problem for recovery. So that's why it makes it even more difficult. So we are gonna, next week actually, Tanner, I do wanna share our clinical management approach with our audience, so that there are some new data coming up, and then we can tell how we are actually managing certain situations differently with our case conferences from our ACO. And then I know that United Medical ACO had a much better outcome with our patients during the pandemic. That's because we were supporting our providers at the level that we did, and our hospitalization was a lot lower than average hospitalization, and our follow-ups were higher, our telemedicine was higher. So not how we are going to manage these issues is just going to be by increasing the bar to a next level. So we are doing these events for private practices and then supporting private practices. We had so many different events. These are some of the highlights. And we want to be that voice for our physicians on the private settings, in the outpatient settings. So what does that mean is already kind of working for us, that we have a meeting later on today with our state officials to better represent our network. So as we are going through this, what we realize is that, we discuss so many different issues, but sometimes we kind of shy away from our core business, which is the revenue cycle management. And as we were preparing for this, I reached out to Richa and said, look, we have, we should be able to discuss why our revenue cycle management, medical billing part of our business is also at a much higher quality level. And then Richa is going to join us right now. She's, yep, there she is. So, Richa, thank you for joining us.
Thank you, Kemal. Thank you for having me.
Would you like to just introduce yourself and then we'll start?
Sure. Yeah. So my name is Richa Shah, as Kemal had mentioned. I am the Director of Billing Operations at United Medical. I've been with the company for 10 years. And I manage the department that handles our payment posting, coding, accounts receivables, collections, and our statements. So it's essentially our core business, as Kemal said, and I help manage all of those different departments.
So, Richa, I'll start with this extremely great score that we have, 96.7 client satisfaction. And this is not a fake number, this is real. So tell us how we actually get to that.
Sure. So we actually survey, Kemal, some of the core metrics that we know that the clients would be interested in, and we essentially ask them, do you feel as if your manager is taking care of your account? Do you feel like your posting is being done correctly? Are you satisfied with the overall services? Are you satisfied with the response rate? So those are some of the questions that we ask, because that's sort of what we provide from the United Medical side is a really robust organization where we are constantly in contact with our clients, assisting them every step of the way. So we want to ask them, every month or every quarter at least, are you satisfied with how we're performing? And we really take it seriously. So, and if we ever get a negative feedback, you or I immediately respond to make sure that that is resolved. And I think that's why our satisfaction rate is so high.
So the other thing is that I want to ask you, I'm going to bring our presentation from yesterday we did for our partner Cerner. So we are utilizing a couple different PM systems. If you can actually tell us what PM system is, what it is when we say PM, and then what United Medical is using, and who we work with.
Absolutely. So the practice management system is essentially the place where all of our billing gets completed, meaning that is where our billing is entered. That is where we send claims from. That's where we receive payments into. So it's essentially a hub of all of the information we need to be able to manage our practice from the financial or billing side. It also includes many, many reports that help us determine production, financial, payments, adjustments. So all of that information is within our practice management system now. Currently, we are servicing 3 practice management systems. The largest one is specialty practice. We also service PDS clients. However, those are clients that are actually going to be switching to SPM soon, because that particular system is going to be sunsetting. And then we also service clients in a system called CPM, Cerner Practice Management System. So those are the 3 systems we use. And we work with Cerner, and we also work with R1, which is the company that took over for the business office side for Cerner, which was handling the billing. So that's essentially how the makeup is of the practice management.
So the SPM, specialty PM, is something that we are utilizing in the offices, as well as we also utilize in our business office for RCM medical billing purpose, right, Richard? So now, just so that we know, also our clients and prospects, they know that why we like SPM. So if you can kind of go through the process with check in, check out, and the easiness of the system, what makes SPM easier or more user-friendly for us?
Sure. So SPM is actually very user-friendly. Every step of the patient registration process is very easy to follow. It's step-by-step. We have determined the fields that we need practices to fill out, so they really don't have to think about it. It tells them, you need to fill out these sections in order to move forward. So that's the information that they normally gather from the patients. We also make sure that our practices understand that it's very important to do verification of insurance. Now, some of our practices use verification within the specialty management system. We actually have something built in that will check a couple of days before the patient comes in whether their insurance is valid or active or not. And then we also have practices who do that manually. So these are important parts of registering the patient. And also at the time that the patient comes to the office, we want to make sure we're telling practices to check if they have a copay, if they have any outstanding balances, that sort of thing. And all of that is very easy within the practice management system. There's a prompt for if the patient has a copay, it'll pop up when you check in the patient and say, please collect $20 from the patient. So it's really easy and seamless to follow. And I believe that, our practices are very successful in registering patients and also gathering information.
And then this goes to the checkout process as well, right? So then from the check-in to the checkout, patients seen in between. So how does SPM helps us from that point?
Absolutely. So the checkout process is almost, even easier because we have an interface with our EMR where most of our providers enter their charges and their diagnosis codes and even modifiers through the EMR. What happens is when the doctor puts that information in, it automatically crosses over to the specialty management system. So the job of the front desk staff is just to verify that the information is correct and push it forward with just a few clicks. And also, within the EMR system, Kamal, the practice management is the practice managers and the practice staff are taught to, give any information that the patient may need, patient education, that sort of thing that comes from our EMR. So all of the information essentially needed to kind of move the patient through the process is all within either our specialty management system or our EMR.
So if you remember several years ago well, you've been with us for 10 years, but then prior to that, we have, like before your master's, you were for a couple of years, right? It's that 10 years doesn't include that.
No, I was at United Medical for about a year between my undergrad and my master's. So.
You went to DC and then did your master's and then came back. Now, the reason I'm saying that is because we built the RCM workflow long time ago, and this was kind of our way of checking what the full flow would be for our practices from the time that patient comes to the business office, to the physician's office, and then what our system is with the electronic submission process, and then how we work on the denials, what happens with the after the RCM work, and then how we actually work on the corrections. And then this is a full flow that actually was our kind of foundation. So one of the reasons that I always say that the PM system is a great vehicle for us to be able to run the system efficiently. And then now we are glad that it's going to be the default for our clients. And then as the medical field is extremely heavily regulated, for us to be on top of all these changes, we need to be working with the latest software, and I think Cerner is able to provide us that. And I'm happy that we are actually improving SPM and getting more people under the SPM umbrella. So, yeah. Richard, anything you would like to add?
With specialty management is, United Medical is a huge part of the enhancements. We're so knowledgeable in the system that Cerner really looks to us with every single update to ask us what we need, what ideas we have, if any changes are needed. We are always a beta client for testing all SPM updates. I don't remember a time within the past 10 years where we've not been a beta client. So we really are, I believe, an integral part of how SPM evolves and grows. So I think we're definitely the experts in this.
So Tanner, from the business development side, your team also is part of the training. So I know right now having 3 different PM systems, you guys spend a lot of time on different trainings, but I think it's going to help you guys as well, right? Being just kind of consolidating them. Now, is it easier to train in SPM than other systems?
I think it is personally. Yeah, I enjoy training out of SPM. I think as everything Reach has gone over is very correct and accurate. I think a lot of people, once we do end up training them, especially with the check-in and check-out processes, when we do have new employees come in and we're doing trainings with them, they oftentimes find it pretty easy to pick up and quick to learn. So there's never really a lot of pushback with the workflows that we have set in process and how everyone has been trained to work through the system. When it does come to having patients come in, new patient registration, getting patients checked in for their providers, and then on the back end, getting the checkout and charges pushed through as well. So I've only had good experiences with training new clients and training new staff through SPM, and I am excited to have everyone on the same platform going forward. I think it'll be make for a seamless transition for a lot of our clients.
So, I am going to share something else with you guys, if I can find it, but I couldn't. Let's see. So that actually, you guys don't know this one yet. Let's see, where is it? So you guys remember, not remember, of course, you guys know our Dr. Gora, right? So she is, she just published a book. So I just knew that yesterday. So let me actually just bring that up. I was trying to bring it up from Amazon, and it is on the, it is there actually on the Amazon application, but I couldn't find it on the website. The book is called, let's see. It's Only a Bump. It is for, I will next week, actually, I'll share the actual site, but here it is. So this book actually is now available on Amazon and a couple other places. So Tanner, maybe for the next one, we can actually just share the cover page.
Sure.
So I was actually kind of excited about that. So it was a surprise. And, I have a couple of different providers who are working on different books. One of my friends from Turkey, he just finished another book, and I was so proud of him. But then from our physicians, I know Dr. Erkan is working on one, but I didn't know that Dr. Gora was actually, and it was a pleasant surprise. At some point, I want to actually finish what I started, but when I see the end result, it kind of motivates us. So we'll order some for us here, but we should actually promote that from our events. So guys, this was really nice to have Richard. Like every time you're here, we always love to have you. So you can come every week if you want. Tanner, thank you for all the help that you have. And we have another event today at 1 p.m. So our Wednesday bariatric event is going to be now on Friday, just following this event at 1 p.m. So we'll be starting in 15 minutes. So we'll see you there with Dr. Erkan. And thank you again and have a nice weekend.